A hiatal hernia occurs when the stomach pushes up through an opening in the diaphragm. The diaphragm, a muscle that separates the abdomen from the chest, has a small opening called the hiatus or esophageal hiatus. The stomach pushing through the hiatus causes it to be called hiatal hernia. There are three main types of hiatal hernias. Sliding hiatal hernias represent the most prevalent form of hiatal hernia, also referred to as a type 1 hiatal hernia. In this condition, the upper section of the stomach and the gastroesophageal junction, GEJ, ascend through the esophageal hiatus in the diaphragm. This movement takes place even while breathing and eating. A paraesophageal hiatal hernia, also called a type 2 hiatal hernia, occurs when the stomach pushes up through the hiatus next to the esophagus. However, the gastroesophageal junction, GEJ, remains in its normal position. Although less frequent, this type of hernia can be more severe. A mixed hiatal hernia is a combination of a sliding hiatal hernia and a paraesophageal hiatal hernia. These hernias occur when both the GEJ and a portion of the stomach herniate through the esophageal hiatus, but the GEJ is not fully displaced. Although less common than sliding hiatal hernias, mixed hiatal hernias are more prone to causing complications.